Welcome to the Boys and Girls Haven Happenings podcast, featuring conversations and stories designed to equip, mobilize, and encourage our community to support children and young adults in foster care. Sit back, relax, and enjoy this episode of Haven Happenings. All right. Well, happy Pride Month, Shonda. Thank you for being here.
Whoop, whoop.
Thank you for my little pride flag as well.
You're welcome.
Am I allowed to keep this?
You can absolutely keep it.
This is
I'm regifting it.
Yes. Who's it from originally?
I got it for my birthday last year from a former coworker who is LGBTQ.
Nice. So I probably shouldn't tell them that you're regifting.
I think they would be okay with it.
They'd be okay with it?
Yeah.
That's good.
Yeah. It still has a good home.
Nice.
I feel.
Thank you.
Yeah.
I'm honored that you think that.
It maybe end up as a family.
Hello, lovely listeners, podcast enthusiasts, Boys and Girls Haven staff, and community members. This is Nick Brewer, the producer of the Haven Happenings podcast, and also the marketing and design manager at Boys and Girls Haven. It is terrific to have you all back with us. Today, we have a very special episode in honor of Pride Month. I'll be playing back what I think is a very thought-provoking conversation I had with Dr. Gary Mallon.
I'm Gary Mallon.
We discussed the unique experiences of LGBTQ youth in foster care. We also covered some of the incredible work being done to support them, and we also touched on a lot of the work that still needs to be done. But first, let me introduce Dr. Gary. For more than 47 years, Dr. Mallon has been a child welfare practitioner, advocate, educator, and researcher.
I'm a professor at the Hunter College School of Social Work, Silverman School of Social Work. I've been here at Hunter for 33 years.
Dr. Gary was the first child welfare professional in the U.S. to research, write about, and develop programs for LGBTQ youth in child welfare settings.
My practice experience is almost exclusively working with lesbian, gay, bi, trans, and questioning young people and their families in child welfare settings. When I started, not a lot of people were doing this. Nowadays, quite a few people are doing it, which is wonderful to see that it's grown in acceptance and it's not so novel.
You can learn more about Dr. Mallon, including a list of his full credentials at garymallon.com, or
I actually have a Wikipedia page too, which
on his Wikipedia page. You can find both of those links in the description. Hey, doctor. Hello.
Hey, how are you?
Hey, doing well. Can you hear me? Let me give you a little background real quick about how this Dr. Mallon interview started.
Okay.
I've been wanting to do a podcast about Pride Month and about LGBTQ youth in foster care for a while. I think I maybe mentioned that to Michael Weinrock, who's our grant writer. My coworker, Mike Weinrock, sent over your article in the Living in Canada. Lovely man.
Love Mike.
Yeah, you're familiar.
Yes.
And Mike, I think maybe 2-3 days later, shot an article over to me on email that was from Dr. Mallon. It was exactly the kind of stuff I wanted to touch on. A lot of themes about policy, kind of outside of foster care and also within it, and then the institutions within agencies like ours, but also individual foster homes and so on. So yeah, I was like, it's kind of a shot in the dark. I was like, yeah, Mike, if you want to set up a meeting, that'd be awesome. And
He sent me a really, really lovely email about a training I did 25 years ago that he remembered. I was like, wow, that's amazing. I can't believe somebody would remember that. So it made my day. So I'm happy to be here.
Yeah, well, that article basically outlined all the research he had done, or a lot of the research he had done with LGBTQ youth in foster care over a number of years.
Well, I started working as a child care worker at a small agency in upstate New York called St. Dominic's Home for Children in 1976. And, I worked with children between the ages of 6 and 13. In those days, no one talked about gay, lesbian, bi, trans. That wasn't even an issue. If you found two kids engaging in same-sex sexual behavior and you talked about it, they would just say, oh, that's homosexual acting out. Don't worry about it. It's transitional. It'll go away. I mean, and that was about it. Like, there was no training, no discussion. Was
it even criminalized back then?
It wasn't criminalized, but it was certainly frowned upon, and certainly
Yeah.
like something that was like taboo. People didn't talk about it. And especially, in child welfare agencies, if kids engaged in sexual behavior, it was like what they called inadequate guardianship. So agencies got very nervous about that because it was like they didn't want somebody from the licensing department to say, well, why were these kids engaging in same-sex sexual behavior? They used to call it homosexual acting out. So,
Okay.
they were very paranoid about it. No one wanted to talk about it. And literally, there were some kids who were gay. There were some kids who were just playing around. But in
Mhm.
reality, there was absolutely no training or discussion about it. So, you
Yeah.
really didn't deal with it. And it wasn't until later when I started working with adolescents where people were talking, maybe 10 years later, where people were talking about it a little bit more. And then when I went to Green Chimneys in like 1987, I think, I walked into this program for teenagers, and within an hour, six of these kids came to me and said, "We need to meet with you." And I said, "Sure." And they said, "Well, we just want to let you know that like we're openly gay, and we want to make sure that you, as the new director, are not going to change anything about us being who we are." And I said, "Absolutely not. First of all, I'm thrilled that you're comfortable enough to talk about that, and I have no intention of changing that. But why is it okay here? Because every other place I've ever worked, it hasn't been okay."
Yeah.
And they said, "Well, basically because the staff here treat us with dignity and respect." And that was the secret. There was no training still. There was no discussion about it much, but they treated them like they would treat any other kid. And for these young people, that made all the difference. So that was
Absolutely.
kind of my entree into it. And then I started developing training and practice and doing research. But it was because of those openly wonderful, brave kids who had said, "This is who we are, and we're not going to change, and we hope that you don't try to change us either." And I always tell this story because it's kind of funny, but it's true. One of the kids in the group said to me afterwards, "I need to speak with you privately afterwards." And I thought, "Oh, yeah, sure. This poor kid probably has a lot of problems and he really needs to talk about it with me." And he said, after I met with him privately, he said, "I just want to let you know that we've all been talking amongst ourselves, and we know that you're like a big old queen and you need to come out of the closet." Which is really
That's
funny because he was like,
amazing.
yeah,
Yeah.
and they were absolutely right, except
Yeah.
that at that time I was married to a woman. I was not out of the
Oh,
closet,
okay.
and they could tell.
They could
So
tell.
the funny thing was is that I had been doing all this hiding for all these years, and these kids, as they would say, spooked me like immediately.
Yeah.
So and I did
They
come
had
out
you
about
dialed.
6 months later. Yeah, and the
Wow.
kid who said that is now like 57, 58 years old, and I still
Wow.
talk to him.
That's amazing.
He keeps in touch with me, and I always laugh about the fact that he's the one who dragged me out of the closet. So
Oh my, yeah, dragged you out.
literally.
I mean, what a kind of cool experience though to be able to share that with
Oh
them.
yeah.
And I mean, not
Oh
only are
yeah.
you like working with them in that capacity, but you're also kind of living through it yourself in a way. And
Yeah.
I'm
Well, and I learned a lot by watching them. I mean, I think the thing that really touched me the most is they were so brave. I mean, these kids were like
yeah.
in foster care, 16, 17 years old, and they were being who they were. And I was like 30 and still struggling. So, for me, it was like, this wonderful experience of, learning to be yourself because these kids were so brave about being who they were. And they were. I mean, I had trans kids who were openly trans at that time. I mean, nobody was trans then. We didn't even really understand trans folks,
Right.
but it was a really wonderful experience
Yeah.
for me and I think for them too. So,
Yeah, well, I'll say too, Dr. Gary, I was born in 1997 and growing
uh,
up in the 2000s, yeah, I don't remember hearing about trans people at all until much, much later, until more recently.
yeah. And then there's a whole kind of cadre of non-binary young people who are saying, "I'm not gay, I'm not straight, I'm not a male, I'm not female, I'm something else." And it's like, okay, that really confuses professional people because they
Right.
want to be clear. But young people are really claiming these non-binary identities in ways that even when I was doing this work, didn't exist. I mean, nobody was talking about
Mhm.
non-binary 15 years ago.
Have you noticed any key statistics or trends that stand out? And so like that would be an example that like maybe non-binary youth are entering the system more on paper, not just in,
Yeah.
name and person.
Well, the issue has always been because a lot of times people in the child welfare system will say, "Well, give us the stats. Well, how many kids are there?" And I've always said, and I still say, when you're socialized to hide your identity because you're afraid if you really are yourself that you could be abused by the system and people in the system, you're not voluntarily coming out. So that's part of it. But that being said, young people are being more open about who they are. So you are seeing young people who are openly claiming a gay, lesbian, bi, trans, or non-binary identity. I think that's happening around the country more than it was maybe 10 or 15 years ago.
Absolutely.
It's still not, I would say, in most places, safe for a gay kid to be totally open, unless there are other gay kids in that home or in that program, or if there are gay, lesbian, bi, or trans staff who are visible. If that's the case, then you are seeing kids who will say, okay, if there's staff here that are openly gay, or if there's other kids here that are openly gay, then maybe it's okay for me to be who I am. But most kids, because of safety, are saying, I'm not going to really talk about this until I can determine that it's safe for me. And the only way that it'll be safe in child welfare agencies is if there's policies and if there's training and if there's supervision that speaks to these issues. And in most cases, that's still not the case. Now, the federal government did come out with guidelines a couple of months ago saying that, child welfare agencies and foster care agencies should promote safe spaces for LGBTQ youth. And that's great. And I know the people who put that together and they consulted with me and we talked about it. But, it's a piece of paper. So it depends on where you are. It's not a law, it's a guideline. So therefore, people are going to do what they do, which is, if it's not so cumbersome for them to enact that, they will. If they get additional funds to do training, they will. If they have to dip into other funds to do training on this issue, they won't. And the reality is the child welfare system has a lot of problems, a lot of issues. I mean, I just finished doing like a year's worth of work in Louisiana on, family group conferencing with families whose kids were coming into the child welfare system. I never talked about gay once because the problems that they brought were so extreme, poverty and substance abuse and domestic violence and mental health, that you were overwhelmed by what you had to deal with. So
Yeah.
it kind of opened my eyes in a way of like, even though for me, this has been a very important issue, in lots of families, it's not really there. You're dealing with all these other issues. And that being said, I still think it's important for foster care and child welfare systems to be affirming to LGBTQ people, not just in June when it's Gay Pride Month, but like all, to really include training and supervision and content on these areas. I think that really needs to start at what we call kind of when new workers come, like new worker training, where you incorporate vignettes and examples of like, a lesbian couple who are adopting a child, or a gay boy who's in a group home who is found in bed with another boy. I mean, how do you deal with these issues rather than kind of making it this big deal when it happens? Is kind of talk about it as you're training people in a normative way. But
Absolutely.
you really need policies and practices as well, and a lot of places don't have them, and there are many examples of them nowadays. There's lots of state, like the West Coast, the East Coast. They're always thinking that they're the only ones in the world that have dealt with this problem. Chicago has struggled with it. Texas, I mean, all over. I've done TA and consultation in probably almost every state. I can't point to a state that has gotten it right. Maybe California and New York, but only because they're such big states and they have the biggest child welfare populations that they have to kind of address lots of different issues. But I wouldn't say that the policies and practices that they developed in New York are totally applicable, for instance, in Kentucky. I think you'd
Right.
have to modify them and talk about what works best for children, youth, and families in Kentucky.
So obviously context is hugely important when you're drafting these documents and when you're looking at individual policies, trainings, and day-to-day practices. In your article, you mentioned studies from the UK, the Netherlands, and Norway that helped you to identify some common experiences between youth and foster care. And
Mhm.
so, you mentioned California and some other US states, but are there any interesting policies or practices that you noticed in some of these European countries that you think would be important or helpful to bring over here?
I wish there were, Nick. Basically, what and we can add Ireland to that. I've been doing a lot of
Okay.
work in Ireland lately, and the funny thing is that it's not funny, but the people in the Netherlands and Spain are very good friends of mine, and they replicated my study in the Netherlands and in Spain.
Did they?
And 30 years later, guess what? They found the exact same things that I found 30
Yeah.
years ago in New York.
It's good to
And
validate your data, though, right?
yeah, yeah,
Yeah.
30 years later, you would
Yeah.
wish that something was really dramatically different. It's not.
Right.
The kids would say staff don't understand us, staff don't really know how to deal with us. I saw less what I would call violence. When I was doing my studies, I found a lot of cases where kids were really beaten up by other kids, or in some cases by staff, or the staff allowed it to happen. We didn't find that in the Netherlands and in Spain, which that's a great thing. But we didn't find like any kind of advanced training. We didn't find any kind of great practices. And as a result of those studies, what we did do, though, is then started to provide technical assistance around how to develop policies and practices in those places. And they were serious about implementing them, especially in Spain. I mean, they really took it on. There were absolutely, in northern Spain, there was absolutely no services for LGBTQ young people in the north of Spain. And I jokingly said, where do all these kids go? Barcelona and Madrid? And they all burst out laughing because that's what happens, is they migrate to cities. So, but also what happens when that happens is that then those localities are exempt from providing services for kids who actually live there. So, in that case, they're struggling with it, they're thinking about it, they're moving in a positive direction, and that's a good thing. But there's no great promising practices that have come from them that I didn't
Okay.
see before.
No notable policy initiatives or legal frameworks. Still lots of gaps. And it
Yeah,
sounds like,
yeah,
I know you mentioned early on that statistics have a tendency to lie when people are,
yeah,
afraid to answer honestly. And something that's very anecdotal from my own experiences. I remember reading the intake paperwork. Openly gay kid placed with a very, very hyper religious family who I assume disagreed strongly with this kid being gay. Um, and they beat the kid pretty severely. The kid was removed. The family or the parents were arrested and charged. But this kid is obviously going to have that trauma with them the rest of their life, probably. And there are, foster parents who have no business fostering a gay youth, or, staff who are maybe still behind the times in that way. And
yeah.
it only takes one bad experience to cause trauma. So,
I mean, when you have openly gay staff, the message is, or affirming staff, whether they're gay or not,
yeah.
is it's okay to be yourself, and that's what you want kids to hear.
Mm.
And you want to place kids in homes where some religious people might be fine with gay kids, but some are not.
Yeah.
So you want to place them in a home where you feel they're going to be safe. And I think there's a necessity for evaluating the foster parents too, in the sense of saying, how would you respond if a child in your home came out to you? I mean, that's like foster parent training, right?
Right.
When they do MAP training or whatever, how do you think? And some families will say, oh, no, I couldn't deal with that, or no, I'm deeply
Yeah.
okay. Well, then that's pretty clear.
It's important to
Other families,
ask. And right.
yeah, other families might say, yeah, I think I'd be okay with that. I'm all right. I have a brother who's gay. I'm cool with gay people. I could deal with that. So I think it's a matter of kind of being comfortable about it, talking about it. And the one thing I would say is that I just think that the policy part is important, because it might be good when there are right now openly gay staff working in the agency, but 5 years
In the
from now,
future.
if some of those people are gone, who are they replaced with? And if there's no policy, people revert back to using their own policies, right? And I used
Right.
to always say, in the absence of policy, people create their own policy.
Mhm.
So, that's why the policies as written need to be enforced. We did a lot of work in that in Louisiana. And, now they have a new governor, a Republican, very conservative governor, and I'm sure he'll undo everything that we did, which is what happens in child welfare, sadly. As you
Mhm.
have one administration that is progressive, and then another one comes in, they're very conservative, and they undo everything that the previous one did. So, but that's a child welfare problem. It's not even an LGBTQ problem.
Yeah.
So, it's after being in this field for, almost 50 years, you see a lot of ups and downs and a lot of things that change
Uh,
over time. Not always good.
yeah, I believe it. It sounds torturous, honestly. I've experienced in my 3 to 4 years a lot of ups and downs within the system,
Yeah.
on a
Yeah.
broader scale, and it can definitely be frustrating. I feel you.
Oh yeah.
Yeah.
Yep.
So, do you have any specific examples of things that caregivers can do specifically that are positive and help to create that affirming environment for children in foster care?
Yeah, I think sometimes you have to do it very blatantly. Like, for instance, a lot of agencies are like, well, we need to have artwork that is representative of our clients. So, they have African American, artwork, and they have Latino artwork if they have those clients. But, with gay kids, is there anything in that physical environment that would suggest it's okay to talk about being gay? Is there, a gay pride poster? Is there a rainbow flag? It's something small. We used to develop these little safe zone stickers where we would tell people, you could put on a bulletin board, you could put it on a door, and it would just act as a bridge for the kid to have that conversation and to see that, like, oh, there's a safe zone sticker.
Yeah.
Maybe I could talk to that social worker about this. So, I mean, that's one way. The other way is to just incorporate language into your conversation in a normative way. Like when you're talking to kids, we always do this. Like, it's okay for you to talk about anything here. You can talk about, past experiences you've had. You could talk about, any kind of violence maybe that you've seen in your life. You could talk about problems you have in school. You could talk about, sexual identity issues. If you incorporate some of that language, kids are listening to that and they're saying to themselves, oh, maybe I can talk to that person about this. I haven't been before, but it's really about the worker putting out the cue. A lot of times the workers look for the cues in the kids, like, how can I tell if that kid's gay? But I always say it's really about the worker putting that out there. And I think it's really important that the worker puts that out there for all kids, not just for the ones you think might be LGBTQ. Because like,
Right.
the straight girl might say, I think lesbians are disgusting. And it gives you an opportunity to say, well, gee, the group home that you're living in has several young people who identify as lesbian. How do you get along with them? I mean, it gives you an opportunity to have a conversation
Right.
about it. And I think as well, what we just need to do is have staff that are comfortable talking about the issues and not saying, oh, I don't want to send them over the edge. I don't want to, talk about that, because if I talk about it, then they're going to think it's okay to be that way. Well, the reality is it is okay to be that way. And if a kid is openly gay and comfortable about it, there's nothing you're going to do to change them from being who they are. And
Right.
and sexual identity is different from sexual behavior. A lot of people panic, like, oh my God, they're going to be having sex with all the other boys in the group home. Well, they might try, but because, when you have a group home with all boys, they're going to do a whole bunch of things, or all girls.
Yeah.
But, the idea is that's not the message. The message is it's okay to be who you are. And yeah, but you can't have sex with your roommate,
Yeah.
and
Identity.
to have a comfortable conversation about that.
Yeah. Identity doesn't dictate, actions and like
Yeah,
certain contexts. Like, yeah, there's still,
yeah,
expected behavior in certain places.
yeah.
And yeah, like you,
Well, and staff need to be held accountable. Like if when we first started admitting trans kids, some of our staff would say, "Well, that kid asked me to call him she. I'm not doing that. I'm not calling him by his girl name." And I would say, "Well, our practice is you use the pronoun that the young person has asked you to use, and if they're asking you to use a different name, then we use that name." And
right.
they'd say, "Well, I don't agree with that." And say, "Well, that's not your decision to make. You're an employee of the agency, and our practice is this."
Yeah.
And most people would get it.
Well, that's where having
sometimes you
policies written is very
that's
important.
right.
It sounds like,
Yep,
'cause then you have something to fall
absolutely.
back on and you can address it
Yeah,
with them in a more black
yeah.
letter kind of way.
Yeah, and I think also sometimes the training is really good around that. It's like, just talk about it so that people can say out loud, "Well, I don't agree with that," and say, "Okay, well, why don't you agree with that? Let's talk about
Yeah, you can
it." And
educate.
like, and
Yeah.
in the end, you can say, "Doesn't really matter if you agree with it or not. This is our policy. Like, if you're not
Mhm.
comfortable with it, then maybe you don't want to work here." You know.
Yeah.
But I think you can have conversation. I mean, I can't tell you. I've done training all over the country, and I remember doing training in Mississippi, like 20 years ago. And
Mhm.
this one woman came up to me at the end and she said, I just want to tell you that I'm a God-fearing woman and I read the Bible every day. And when they told me I had to come to your workshop, I didn't think I was going to enjoy it, but I really learned a lot by being here. And I said,
Yeah.
well, you know what? That's wonderful. That's all I'm asking, is that you opened your mind a little bit. I'm not asking you to change your religion. I'm not asking you to change who you are. Just,
Mhm.
these are young people who can't live at home with their families. And we want to make sure that they're treated with dignity and respect. That's not so hard to do. So if you learn
Yeah.
something, wonderful. Thank you for telling me that. So
Mhm.
I've also gotten, I'll never forget this one. I got workshop evaluations that said one time that, Dr. Mallon thinks he's very funny and he uses a lot of humor, but he is going to hell. He will
Oh.
burn in the eternal fires of
Oh.
damnation. You're like, oh my God, that's a pretty bad
That
evaluation,
is a
right? I mean,
that is a sharp turn. Wow.
oh yeah.
But
So but that was not as much. I mean, those stand
that's
out
the
to you because they're pretty
minority of,
extreme. Yeah,
yeah, that's pretty
but
memorable to hear.
yeah, most people kind of were happy that they learned something, and they were going to go away and try to enact that if they could. So
And in my experience with anything contentious or that could be perceived as contentious, if I approach it from a calm place and am respectfully trying to educate somebody, they're much more receptive. And
oh
yeah,
yeah,
usually, yeah,
yeah,
9 times out of 10, you have really positive interactions and you both leave having learned a little bit about the other. And yeah,
yeah,
it feels
yeah,
good. So it's nice to hear that people who you wouldn't expect necessarily to gain a lot from these seminars are coming away having
yeah.
learned something.
Well, and you know what? I've been doing this a long time, so I intentionally use humor. I
Mhm.
intentionally talk about like my mother. I talk
Yeah.
about my family because people don't expect that. So
Yeah.
and they laugh, and they don't expect to laugh either because a lot of times, and I used to see this when I first started. Some of the training I would go to were done by like these very hardcore gay and lesbian activists. And like if somebody made a mistake, they would like beat them up in the middle of the training. And it was like,
Yeah.
that's horrible. I mean, nobody wanted to come. People were afraid. And so what I would try to do is turn it into something that was fun, that you could
Mhm.
laugh, and you made it comfortable enough that people could ask any kind of question they want. I would always say, you can ask anything you want. Nothing that you're going to ask me is something I haven't heard before. If I think it's too personal, I might say, well, I'm not going to answer that because it's really personal. But I
Right.
mean, that was very rare.
But you're not
You
going to beat them
know,
up over it. And
yeah, no, not at all.
well, and it makes a lot of sense because in any academic or educational environment, you shouldn't be afraid to ask questions, or it's not going to be conducive to your learning if you are. Um, if
Yeah,
you're if you're not given the space to learn in a safe environment, you're not going to. So it makes sense
right.
that people who would beat somebody up over mistakes or questions are not going to be as effective as teachers.
Yeah, yeah.
Yeah.
So over the years, you learn a lot about things that work and things that don't work, and things that get people really uncomfortable, and things that kind of make people laugh a little bit and loosen up, so that they hear you better.
I like how you mentioned normalizing language within agencies and individuals, and um, I take that as almost like micro affirmations. The inverse of
Yeah.
microaggressions is, yeah, just small things you can do, like asking somebody their pronouns or wearing a like a pride flag shirt.
Our
Um,
administrators attending the training. That's really important too. Like,
yeah,
when workers see the administration in the training, that's a big thing. I remember doing a training in a very big Catholic agency here in New York called the New York Family Hospital. And Sister Cecilia Schneider was sitting in the front row. And she stood up at the end and said, we invited Gary here. We want to make sure that all kids are safe here. We 100% support this. That was a big deal because, when they heard her say that, and they saw her sitting in the audience, it was like, oh, okay, well, I guess we really do need to do differently here.
so, looking
Sure.
ahead, what are some important areas for future research or advocacy efforts related to LGBTQ children and youth in foster care? And what should this advocacy look like for foster parents, agencies, and government officials, kind of separately and together?
Right. I mean, I'm going to answer two things. I'll answer your question, then I want to say one last thing.
Yeah, please do.
I think, well, first of all, I think that we haven't done as much work with transgender young people as we need to, and their needs are different, and their experiences are different.
Mhm.
So we need to keep looking at how do we more effectively care for trans young people in the system, and how do we train foster parents to work, and bio parents to care for trans young people in their care. It's very different. I mean,
Yep.
as a birth parent, when you give birth to this, boy who's assigned male at birth and they transition to be female, that's hard. That's difficult for families. So, how do we help that family understand that? And then if we're
Mhm.
going to place a child in a foster home, again, depends on whether they've transitioned before or after the foster placement. How do we help that foster parent, be able to, understand that they're going to need to buy different clothing for that kid. That kid is going to go to school, and there might be opportunities where they have to advocate differently for that kid in school than they would normally. So, I mean, that's one big group. And I just think the other kind of things in the future are, can agents, I mean, I came up with this kind of paradigm of like policy, supervision, training, and then clinical case consultation in the sense of develop policies with people who can help you do that, not by yourself. And there's lots of policies that have already been developed. So no need to reinvent the wheel. There's lots of them all around the country. And then how do you, look at helping supervisors to supervise to the policy? And then how do you train everybody, like new workers, foster parents? And foster parent training is different than agency worker training, because foster parents, and I've been a foster parent, they're living with you in your house and they're living in your neighborhood and in your community. And you need to be really comfortable when that boy goes out of your house with glitter clothes, with the people in your community saying, like, why would they let that kid go out like that? And you have to be able to help foster parents say, look, this young person's experiencing who they are. I'm supporting them. Maybe you're a little uncomfortable with that, but your discomfort with that doesn't mean they shouldn't be who they are. So, try to be a little more open-minded, but really helping foster parents to do that. And people always say, oh, we're going to train our foster parents, but they never do. They train the workers, but they never really get down to training the foster parents. And I did a bunch of training with foster parents in Louisiana, and they were fabulous because most of them are African-American single moms and grandmas. So it was like, they'd ask questions like, Mr. Gary, I don't know if I could deal with that. And I'd say, okay, well, here, let's talk about that. And then after you talked about it, they would say, oh, okay, I think I could do that. Okay, good.
But they weren't afraid to ask questions, though.
No, not at all. And I would always give them a number and say, and if you run across a problem and you can't deal with it, you call me and we'll talk about it. And they wouldn't. They would. Yeah. I still get calls from people, like, as you saw your colleague 25 years later. And then I think, and governments need to, God, I mean, we don't know what's going to happen in this next election, right? And if the guy who was in charge before gets reelected, I'm fearful of what's going to happen. I think that those of us who have been around a while need to keep speaking out against it. And people who are younger, you have to really be careful, because there are things that people will work against you on. So I think we need to really be thoughtful about that. And I mean, and lastly, what I always say to people is, we're in the business of protecting children. I mean, in my own career of working with these young people, I get emails or texts from them, I would say almost every week, from kids I've worked with. Most of them are doing great. They're really doing well. Some of them, I met one the other day. I was on 7th Avenue and 23rd Street coming out of the subway, and there's one of my kids sitting on the street, filthy dirty, with no shoes, no shirt. I'm like, Jermaine, what's going on? He's like, oh, hi. He didn't recognize me at first, and then he did. I'm like, how old are you now? 47 years old, living on the street, HIV positive. I mean, that child, I think we did the best we could when he was with us. I didn't feel guilty, like, oh my God, we should have done better. I mean, he was in a good place. He had many, many problems. I mean, I wish he wasn't living on the street. And actually, I passed by there on Sunday and he wasn't there, which I was like, okay, good. And of course, then I went to the bank and got money and gave him money so he could have food, but that's always tragic when you see that. But I didn't feel like, oh, we failed him. I felt like, well, there were lots of other things in this child's life before he came to us and then afterwards that, we just couldn't attend to. But I think it's really tragic when we've not done what we needed to do and kids harm themselves, or they're so despondent about who they are, or they're so lonely, or they're so depressed that they really can't even imagine what a life would be like. That's because I think we can help fix some of those problems. So I don't think it's all that different from what we do with all kids. We just have to kind of, open our minds to being able to do that in a more thoughtful and compassionate way.
Thank you for tuning in to this episode of the Haven Happenings podcast. You can listen to more episodes or learn more by visiting us online at boysandgirlshaven.org.